Emma Georgieva, and I'm an occupational therapy student. This is my client, Juan Sanchez. He is a 37-year-old male. He has recently suffered a T12 spinal cord injury. He, at this time, has upper extremity 4 plus to 5 active range of motion. His motor skills are fine and within functional normal limits. He does have upper extremity low endurance, but fair static balance. He does not have any sensation below the navel, and a 0 out of 5 for lower extremity strength. He is incontinent in bowel and bladder, and he needs extra time for transfers and lower body dressing due to the fatigue. He does not use any adaptive equipment and requires supervision for same level sliding board transfers with verbal cues for locking the brakes and safety positioning for the wheelchair. He does not perform any pressure relief exercises, and he is currently feeling bitter and resentful about his injury. The intervention I've chosen, the clinical objective is to address endurance and strengthen upper extremities. The client will lay prone on a scooter board and use upper extremities to propel self around the room. He will also unscrew bolts with a wrench as if to simulate he's working on a car. Eventually, he will work up to that particular intervention because I think it will give the client hope, as he has expressed in the past that he does enjoy working on cars and he does not think that he'll be doing this in the future. The materials that are needed for this intervention are the scooter boards, or a mechanic's creeper, which I feel like he has, a car to fix, tools. For this specific one, it'll be a wrench with bolts, and he needs a flat surface to slide around. Depending on the home setting, he might need to install a ramp that will lead down to the garage for the car. He will be motivated to participate in this activity because it is related to cars, and by improving strength and endurance in the upper extremities, the client will become more independent in transfers and wheelchair mobility. Is based on the biomechanical frame of reference, and which typically uses a purposeful activity to improve limited range of motion, endurance, and strength. This frame of reference assumes the individuals are able to regain the ability that is impaired, and in this case, it is the endurance and strength in the upper extremities to improve the occupational performance. Ask the client to push themselves from this side of the room to the other side once, going there and back, and then they will come back to the bolt to the car and use the wrench to unscrew the bolt. And here we go. Intervention I have chosen is re-education on how to prevent pressure ulcers and maintain skin integrity. The intervention is that I will order the client a Rojo cushion because it is the gold standard in preventing pressure sores. This is a flyer I'm going to give the client. Thank you. And I will instruct you that it is very important that you prevent those pressure sores because you are also having trouble with incontinence, and that is very likely to lead into infection if you do get an ulcer. Do you understand?
Yes, thank you for letting me know.
Also, until the cushion arrives, I will help you program your phone and alarm because you have to have at least 2 minutes of pressure relief on the buttocks every hour. There's air-filled compartments that can be adjusted to each individual shape and weight. And if you go on this website right here, there will be pricing, delivery, and maintenance of the cushions is explained. They are very expensive, but it is so important that you don't get an ulcer. This intervention is based on compensation approach to address impairments that are not going to improve, which in this case is the sensation and mobility below the navel. It focuses on specific areas of occupation in maintaining the skin integrity in the prevention of the formation of pressure ulcers. It's important to prevent the pressure ulcers because of the patient's incontinence, and since the client is reluctant to participate in the bowel and bladder prevention program, a pressure sore can easily be infected. The patient will modify the demands of the task by using the Rojo cushion. Here is my reference sheet.